Good afternoon. I am Melissa Toledo Ontiveros with Constellation Consulting, and we are pleased to present the New Mexico 2021 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Tobacco Use Prevention and Control Program, and will take place throughout May on our event app with live sessions each Wednesday afternoon. For more information about the summit, please visit our website at newmexicohealthequity.org. Due to COVID-19, this year's Summit on Health Equity remains an online event. We appreciate those who have participated and supported this year's event, including the New Mexico Department of Health, our Summit Planning Team, Presbyterian Health Services, Conalma Health Foundation, Be Well New Mexico, the Santa Fe Community Foundation, and others. For a full list of our supporters and online exhibitors, please visit our event dashboard online or on the Whova app. I also encourage you to utilize this year's summit on the Health Equity event app. The Whova app provides you with opportunities to network online, schedule COVID-safe meetups, create discussion groups, visit our exhibitors and supporters, watch recordings of sessions you may have missed, download files provided by our presenters, and more. It is a great tool for you to use, not only during our live session, but also throughout the month. Please, when you use the app, you can earn points, which can mean prizes. Please check the leaderboard in Whova for more information. For today's session, attendees' webcams and microphones have been disabled. If you have any questions for today's presenter, please use the Q&A function within Whova, and we will address as many questions as time allows during the Q&A. Also, any materials provided by today's presenter will be posted as part of this session within the event app. Today's presenter will be conducting a mindfulness exercise and post a poll here in a few minutes. You can respond to this poll by selecting polls in this session or the polls section of Whova. If you need assistance during this session, please utilize the Q&A feature or the Ask the Organizers feature in Whova. You may also try emailing us directly at info@constellationnm.com. Following today's session, we appreciate if you take a few minutes to complete our session's feedback by clicking Rate in the session of the Whova app. If you would like to request community health worker or social worker CEUs or continuing medical education units, please include your name and email address on your evaluation, and the CEU certificates will be mailed within 60 days. If you need assistance with CEUs, please email us at info@constellationnm.com. Finally, before we begin, Constellation Consulting acknowledges that our organization operates primarily on the unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black, Asian, and Pacific Islander communities, with whom we stand in solidarity. We are New Mexico, and we were built strong by the diverse people of our communities. There are a variety of organizations supporting health equity throughout our state. We have listed just a few here and encourage you, each and every one of you, to seek out, learn more, become involved with, and support organizations who are building a better New Mexico for all of us. So today we're excited to host John Ames. John is Chief Housing Officer at HopeWorks. He grew up in Albuquerque and has a bachelor's in business administration from the University of New Mexico and a master's in divinity from Lutheran School of Theology in Chicago. He recently worked at the Supportive Housing Coalition of New Mexico, where he managed their Housing First program for 12 years. John's career is devoted to working with marginalized people through the provision of housing and services. You can read all of our presenters' complete bios in our event app and on our website at newmexicohealthequity.org. Please welcome John Ames.
Well, hello. It's really a pleasure to be here today, and I want to thank all of the organizers and sponsors for today's event. Health equity. It must sort of seem weird to attend a conference or my presentation from a guy who's made his career in housing. What does that have to do with health? It's kind of what I was wondering when I actually was invited to do this. So my career has been around housing. It's actually been around things like ministry in the church, AIDS hospice, working with homeless people in various capacities in shelters, primarily in the state of Illinois. And I have actually referred to my career as centered around housing. But in preparation for this presentation, and actually with the work we're doing at HopeWorks these days, I've come to realize that my career and the work we're doing has really been about health, healing, and in particular, healing through housing. A little bit about HopeWorks. We are about 140 employee large, and we've been in business doing this fine work since 1989. 3 departments comprise our organization. One is behavioral health. The other is shelter services. We have a small employment office, and then housing. We've done great work for all of these years. But in light of the events of the last few years, especially the Black Lives Matter protests and emphasis in this country, we really had to look at ourselves closely. And today, all of our programs really are revolving around 3 key ideas: diversity, equity, and inclusion. I'll tell you more about HopeWorks in a few minutes, but I'd first of all like to talk about or have us think about housing and to consider what housing means for our own healthcare and as a place of healing. So as was mentioned in the introduction, I'd like to begin with this time together with a meditation or a mindfulness exercise, really. So to begin with, I ask that you would simply relax. Get comfortable in your seat. You may turn your monitor off if that's a little bit of a distraction. But, and then just perhaps close your eyes and listen to my words and allow yourself to be guided by them. So imagine, if you would, that you are standing in front of the door of your most favorite place that you've ever lived. It could also be a place that you would hope to live. What is it like to be standing in the threshold of that door as you reach for the doorknob? What's going on in your head? What are your anticipations? So as you enter this doorway and you're in this very special place, what do you see? What do you hear? Are there favorite aromas? What are the textures of the walls? Do you hear laughter or crying, silence or loud blaring noises? Stay in that place for a while, just a moment. What memory do you have of this place? What event took place that is dear to your heart? Who shared that with you? You may open your eyes if they're closed, turn on your monitor, and I'd like you to consider two questions. How does home hold you? How does that special place in that moment hold you? And what's that about? And also, how does it give to you? I'd like for you to use the word cloud in the poll to just input a word or a short phrase in answer to those questions. How does this place hold you? And what does it give you? Should be able to enter more words on the poll. In a minute, I'm going to ask the poll the word cloud be shown. I would imagine there's words like safety or caring if it's our favorite place. Maybe it was a fun place. Maybe it was a place of shelter, safety from the storm. Okay, let's look at that word poll together. Or you're looking at it. There's only 3 results. That's fine, though. Can you read them out?
Happy, love, and tranquil.
Happy, love, and tranquil were the words. Those are great words. Well, I would hope that you could think about this further, because in our business of providing housing and the work that we do together here at HopeWorks, housing has, housing is, it's about bricks and mortar. Of course, it's also about people, but we rarely think of housing as having much to do with healthcare. We've heard phrases that are very important. Long-held understanding that housing is healthcare, of course. We also know that housing is a right. But I believe that housing and home is healing. That what we experience when we're safely housed is in fact healing, a place to heal. Heal from the trauma we might experience in our lives, a place to take care of ourselves, to access our needs, our basic needs, as well as our needs towards self-actualization. So the premise for my talk today is that housing is part of healthcare, obviously, and it's part of healing. But in order for this to happen, we need housing must be equitable, and we must seek ways, new ways, especially in these days, to create housing, to make housing available that in fact meets the needs of our citizens, especially those who are homeless. So again, housing is a right. It is healthcare, but I believe that home is healing. And what this does, this belief for me and others, I think, is it brings this down from a head concept of housing to really a heart. And building housing and putting folks into housing as we do is really the work of our hearts, which is why we are really so fulfilled when we're doing it, and why it's so meaningful for us and for the community in which we live here in Albuquerque. So how do we achieve health equity through housing? So there's really sort of four concepts that for me sum up what is needed in order that housing can be equitable, and therefore we have equity in such a way that our health and the care of our health is enhanced. And those four ways are, first of all, in considering the occupants of housing and their special needs. The design and the cost of housing, I think, is huge. We know that housing ought not to be one size fits all, just like a healthcare program ought not to be one size fits all. But we have all kinds of needs, and the needs for housing must be, I think, unique for the occupants of those homes. Access. Obviously, we need to be able to get into housing and make access to housing affordable for our clients and for citizens in the work that we do. I want to go into each one of these in a little more depth, but the fourth parameter is location. That in order for housing to really be that which heals, it has to be in a safe location, a location near things like transportation, schools, you name it, not near municipal dumps, toxic waste sites, or neighborhoods without trees, for instance. So let's look at each of these a little more carefully. And I want to do so in the context of a project that HopeWorks is currently working on. And that's Hope Village. We are really excited here to announce that our very first apartment complex is under construction and will be finished in the fall for occupancy. And this is an amazing project that has been about 4 years in the making. And so I'd like to take some time to describe it, keeping these sort of four parameters for housing equity in mind. First of all, Hope Village is what we call a single site program, a single site project. It's modeled after two similar projects, one in Seattle, Washington, and the other in Denver, Colorado, the Sanderson Apartments. In fact, it actually resembles the Sanderson building in Denver. A number of folks from the city and the county and of HopeWorks and the Mortgage Finance Authority went to Denver 3 years ago, looked at the building, looked at the model, and knew immediately that such a model and this type of housing would be well suited for our community, low-income homeless community in Albuquerque. So single site. First, it is a collaboration with the city of Albuquerque, Bernalillo County, the Mortgage Finance Authority that will help us to access funds from HUD, Housing and Urban Development in Washington. So we actually have state, city, and county funds in this building. And it's single site, meaning that every person who lives in this building is from the same population. It's not a mixed use facility as we might know of here in Albuquerque or other municipalities throughout the state. Those work very well for many of our clients, but this particular building is for a group of individuals who have experienced homelessness that are extremely difficult to house and need far more support than they can receive when they're living on their own. And they're also, though, not ready or willing to move into a group home. They're not, their needs are not that for a group home setting. So this is sort of in between. It'll have 42 apartments, all of whom are occupied by this, all of which are occupied by this population. And the other piece of the building is staff support, all kinds of support for the clients is located in the building too. In addition to overnight staffing, we'll have 24/7 staffing in the building. So the first parameter is equity, and equity for whom. So the population that we're choosing to serve and that we've all agreed to serve, all of our partners together, is folks with the most severe mental illness and people that we label. I don't like labeling anybody, but we've used the label high utilizers, which means that these are individuals that have been in jail many times, numerous times over the past few years. They've been in the emergency room a lot. They've had overnight stays in the hospital numerous times, and they've also been in and out of our shelter system. Now, we know really who these folks are for the most part. We're keeping, we meaning all of our partners are keeping data on who these individuals are. And our goal is in the fall to move 42 folks basically from the street. Some of them might be precariously housed, which means they might have some sort of temporary shelter, but really need this building more than anything else. And this is a group of individuals that typically do not have access to their apartments. HopeWorks manages about 350 housing vouchers, and we know that a small percentage of folks in scattered site housing just don't make it. They don't because they really need the support that is not available in their own apartment. They also feel isolated to some extent from the community, which they know as being homeless. And they have major issues that need attention. And our experience has been that this population is denied housing over and over again. They might be given a chance for housing, but only one chance. And if they blow it, they're back on the streets seemingly forever. So we are making housing available to a group of people and that typically cannot access it, and housing really isn't designed for them. So there's really no equity for them when it comes to the housing options they have right now in Albuquerque. So the second parameter is equity by design, and I thought we had a slide of a floor plan, but I think I accidentally deleted it. So I'm going to describe this building a bit to you. It is designed by what is called trauma-informed care, trauma-informed architecture, based obviously on trauma-informed care. Really goes along with what I propose is the healing of a home. This home in a way really will heal in some ways our residents who have traumatic experiences throughout their life. And that'll occur in one way through architecture. This building is you can see the picture there, it's about 3 stories tall. It has lots of glazing. Glass is just all over the place, so that there's a sense of openness throughout the building. Over 50% of the square footage of this building is common space. So when you walk into this building, you immediately have a sense of openness. You are not going to feel enclosed, and our clients are going to feel like they're going to have room to move about and take their time in adjusting to this space. The hallways are the really cool part of our building. And as soon as we have our ribbon cutting, we would like to have you come in and look at this building. But the hallways actually begin at the core of the building. This is an L-shaped building. So there's two main hallways. And those hallways are wide, about 12 feet wide at the core of the building, and then narrow down to something like 6 or 8 feet. So as one stands in the core of the building, walking down to that last apartment, you can actually see that no one is standing in the hallway and to accost you or just to sneak up on you. There's a sense of safety as one walks down the hallway. And that will really give comfort to the clients who live there. There are no places for people to hide. The building has this openness, and at the end of each hallway is a large window from floor to ceiling. There's other ways in which the units are designed for this particular population of folks. There are no blind spots even in the units where someone might hide. When walks in the unit, there's no door to the bedroom. You can look all the way from the front door through the bedroom to the back wall at a window. In the corner of the bedroom, there's actually a notch that has been cut out of the wall. So when you go into the bedroom and look to your right, even before you go into your apartment, you know that no one's hiding in that corner. These really seem like simple things and like no big deal, perhaps to you and I, but they're huge for individuals with mental illness who've been on the streets, who don't want to go into tight places. They don't want to go into the shelter. And it's going to be a very new experience for them to go here into these apartments. Other things that are unique to this apartment unit is that the electrical systems and the controls to those systems are all in the hallways. There will be no mechanical devices to play with. And that again is for their own safety and the safety of their neighbors in the building. As I've said, there's 24/7 staffing. There will be a safety monitor that is not a security officer. He or she will not be wearing a uniform, but rather someone who's really trained in de-escalation training, who's an active listener and help to de-escalate and really make, again, any particular situation feel safe. We'll also have a client advocate on duty around the clock. And finally, at the ground floor of this great building, we will have two of our major programs at HopeWorks. An ACT team, Assertive Community Treatment team, is in one half of the first floor, and the other is our psychosocial rehab program. Those two programs will be available to the clients and tenants in this building. And we're so excited that our psychosocial rehab program is here. It's now located over on Yale Boulevard near the airport. And it's very difficult for any of our clients to access, let alone those who are currently homeless. And finally, taking a tip from the folks in Denver, we're creating an enclosed patio on which new residents can sleep. We learned from the experience of others that it might not be so easy for our tenants to move in right away. So they can bring their stuff and live out on that patio until they feel comfortable enough to go into their own unit. So equity by design, again, this is really for them. And that will be communicated over and over again as they become familiar with the space. Access. How will they actually be able to get into the building? How will they be selected? This is a topic that's actually currently under discussion with all of our partners because we want to make this as fair as possible. And of course, we want to make sure that those who have these unique needs are in fact receiving the housing. So one of the things we're looking at is a random selection process as opposed to a wait list. And our goal would be to do an amazing amount of marketing to people like yourselves, so that you know how to perhaps assist your clients in getting into this building. We're going to do a lot of marketing in various languages so that the word really gets out between now and we were going to say the 1st of June. We're a little behind the timeline, but basically we will announce the availability of applications in just another week. Once those applications are released, we will actually have a whole month of time for professionals like yourselves with your clients to help them fill out the application and complete release of information forms and some other documentation, and then get it to both HopeWorks and the Bernalillo County Community Connections Program. During the month, we simply will hold those applications and then begin processing them in the month of July, after which we would hope that we will have a random selection process, so that we're looking at really pulling names out of a hat. That's our proposal, as it were, to pull the number associated with the name out of a hat in order to make sure that folks who have these needs can get in. We know today that first come, first serve processes are not equitable, right? No matter what examples you can come up with, whether it be shopping on Black Friday or whatever it might be. The folks with the most resources get in line first and they get the good stuff. That is true for housing, and actually that's really one of the reasons there has been housing discrimination and segregation over the years in this country, is we've used processes like that that are actually unfair to folks with less resources. So it's very important that we think about how one applies in keeping, again, with the population we're serving. The folks that we are serving come first, and everything else we're doing around this building is for them and about them and geared towards them. You know, the lack of access to housing is the root of poverty, and it always has been. And I'd like to call your attention to a book written a few years ago called The Color of Law. If you're interested in really knowing what has happened in this country around housing, I definitely recommend reading it. The author, Richard Rothstein, points out how federal, state, and local government housing policies have really created the two societies that we know about today in this country, two societies that are separate and unequal. And that affects location, it affects how one accesses housing, it affects the cost of housing, especially for African Americans in this country. It's a compelling read. The Color of Law by Richard Rothstein. Speaking for myself, I've long believed that it was the real estate industry that created segregation, redlining, blockbusting, those sorts of things. That, of course, happened and contributed to segregation. But really, it's federal laws that are contrary to our Bill of Rights, in particular the 13th Amendment, that actually have created the housing inequities that we know exist and have existed throughout the history of our country. So access is a huge problem in Albuquerque for housing as well. I'm going to digress a little bit from Hope Village to just the situation we have today. Given we have a really tight housing market right now in Albuquerque. We know that there's new jobs coming about. Large industries are poised to move in and do some great things. But every time that we have a growth spurt like we're anticipating here in Albuquerque, and it's really all over the country, not so much a growth spurt, but the cost of housing is just skyrocketing everywhere. I am a housing geek, and I look at Zillow all the time throughout the state, and I'm really amazed at the costs of housing, not just here in Albuquerque, Santa Fe, but in rural places like Hurley, New Mexico, for instance. It's really becoming extraordinary. So with housing comes a new form of discrimination, unfortunately, with this rise of housing and the need. It's a supply-demand thing, and we're experiencing in our country something called income discrimination, where landlords are and property managers are legally allowed to say they will not accept a voucher. And that is discrimination, because it's racial discrimination, because we know that Black, Indigenous, people of color are disproportionately affected because they are the holders of the majority of housing vouchers in our country. So there are legal means of discriminating today and of segregating that are alive and well in Albuquerque and all of our communities. So HopeWorks is really beginning to launch an initiative to advocate for policy change to eliminate these sorts of disparities and equities. So in addition to building housing, we are beginning to address systemic causes of racism that hinder the work we do, especially around access to housing, health, and healing. Finally, I'm really wordy today, but location is the fourth parameter that really makes for equitable housing. Hope Village, that opens in September, is located right on our HopeWorks campus. That's, of course, intentional and by design. All of our other services are literally across the parking lot, and they're available to all of our new tenants, therapists, case managers. Housing, healthcare for the homeless is a block away from this building. The building's close to bus routes, to city parks, and located in the really blossoming neighborhood of Wells Park. It's not isolated. We would like to have had more grocery stores in the area, but overall, this is a great neighborhood for our tenants and our clients. I'd like to talk a little more about who those occupants are in more detail. Again, I'm getting so excited. I have to admit, I've been forgetting to go through my slide presentation. So bear with me. I'm going to just scroll through real quick. We've talked about design, access, location. I want to talk a little more then, and I'll open it up for questions real quick about HopeWorks and about what our future is and what we're very excited to be doing today. We recently embarked on a total restructuring of our organization, starting from the top. We have 2 CEOs today, and they are doing a fine job of pushing us to explore our new mission in light of today's reality. We've done great services over the years, as I said, but we have to do them in the context of the time in which we live. And our CEOs are pushing us to do just that. One of them, Anam Manthiram, recently authored a white paper entitled "A Statement of Intense and Profound Love." I would encourage you to go to our webpage and read that statement. It's an internal document for all of us, but I think it could be helpful to so many other people, especially in similar work. I'd like to quote to Anam real quick. She says in that statement that we must do more than offer shelter, behavioral health and mental health services, employment, and housing. We must commit to a movement of change, beginning with our own hearts and our own minds. For me, that means looking at housing not so much as brick and mortar, but as but first of all about the people that live in housing, going again from the head to the heart. Anam continues by saying that we must believe that the Black Lives Matter, if we want to begin dismantling the system, one person at a time. We must believe that systems of poverty and oppression, again, disproportionately affecting Blacks and other minorities, are inherently racist by design. And we must work to be anti-racist, because the alternative is adhering to foundations of power and privilege that are killing the very people we are trying to serve. I hope that you will visit HopeWorks and visit our webpage, and that this moment together today might be just the beginning of a larger conversation towards health equity through housing. Thank you very much.
Thank you, John. And oops, hold on, because I have my phone on here. I can hear an echo. But as a reminder, if you have any questions for Mr. Ames, please submit your questions through the session Q&A tab in Whova, and we will address as many questions as we can during this time allotted. Okay. We do have a couple of questions, John, and we'll start with question 1. Shelter is one of the most important determinants in an individual's life. Without housing, how can anyone have the same access to healthcare as someone who is housed?
Well, I certainly agree with that. Years ago, there was a model of housing called Housing First. It's still used and it's still great. And it's built on the premise that we have to put people into housing in order that they can access all the other services and really meet their needs. It is really the cornerstone of one's ability to access healthcare for sure.
Thanks. And question number 2, are there any grants that can help pay for housing?
Great question. There's actually a lot of grants, and now with as a result of the pandemic and the response to the pandemic, there's more money than we've ever had for all kinds of housing. We know of New Mexico Help, I think, or I don't actually have the website, but the state of New Mexico has a lot of monies that they're making available to people who are going to face eviction real soon. With the ending of the moratorium on June 30th. Organizations like HopeWorks, we have several different types of housing programs, permanent housing, we have short-term vouchers, transitional housing, and those are common throughout the city and state. We also have monies for rent deposits and even some funds for utility payments, past due payments, to eliminate barriers that might exist for people that are wanting to get back into housing rather quickly. So there are lots of grants and right now a lot of funds for housing.
Fabulous. There doesn't seem to be any more questions.
All right.
So again, I want to thank you, Mr. Ames, for your time and expertise today. We appreciate, we appreciate all your efforts towards creating a true health equity in New Mexico. And thank you to all of our attendees for joining us today and throughout the month of May. Recordings from today's sessions will be posted in the Whova app soon. And these recordings, along with recordings from all other sessions, will stay live in Whova through June 30th. On July 1st, all of this year's sessions will be available at nmhealthequity.org. For questions or more information about the summit and to serve on the 2022 planning team, please email Suzanne Lawson at suzanne@constellationnm.com. Thanks, everyone. We'll see you and hopefully in person next year. Have a great afternoon.